I would like to present our first presenter for today, who is also one of your MCs, Dr. Mohammad Sediq Hazratzai, who will be presenting on the significance of addressing child trauma in Afghan refugees. He is a visiting professor at UC Davis, teaching refugee health and comparative health systems, and is also a credentialed principal investigator with the Public Health Institute and a trainer for the Lotus Project. So please join me in welcoming Dr. Sediq Hazratzai.
All right, as you noticed, we have excellent presentations throughout the day, from causes of child trauma to treatment, barriers to treatment, clinical picture of trauma. But I want to quickly touch base on the significance of addressing child trauma in Afghan refugees, just to kind of set the stage for my colleagues who will be presenting after me. But I won't go into too much detail. As we will be discussing trauma throughout the day, I will go through the definition, the triple trauma paradigm, and the context of trauma and mental health in the refugees, significance of trauma in Afghan refugee children, and also who are the Afghans, because this whole event is today about Afghan refugees, how many they are and how many children we are talking about. So what a definition of trauma. Trauma is an injury. Trauma is the Greek word for wound. If you're an emergency physician, for you, trauma means a contusion or a forceful impact to the body, a head trauma, a chest trauma, or abdominal trauma. But in the context of mental health, as American Psychological Association puts it, trauma is an emotional response to a terrible event. It's an accident, rape, or natural disaster. SAMHSA defines it that individual trauma results from an event, series of events or circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening. That is the key word, trauma. We or our body consider trauma as a life-threatening. That's the difference between stressful situation versus trauma. And that impacts us or affects us our functioning in terms of mental health, physical health, and social, emotional, and spiritual well-being. So based on some definition, the 3 E's are important for the trauma. So what happens when trauma takes place? When children endure multiple traumatic events, especially over a long period of time, that leads to gaps, the so-called missing development stairs. Trauma fractures who children are and who they can be. Trauma changes the way children view themselves and the world around them. When children and youth are exposed to trauma, coping and defense mechanisms develop around safety and survival. And then the children are less focused on managing emotions, relationships, partnerships, and making good choices. Trauma impacts children's brain, physiology, thoughts, feelings, behavior, and relationship. And in normal circumstances, let's say in the case of the United States, but when we talk about trauma, we usually talk about neglect, abuse, or discrimination. But when it comes into the context of refugees, we usually look at the trauma and the triple trauma paradigm view. And especially in the case of Afghans, trauma is usually, we are looking at trauma over a long period of time and complex trauma, not a traumatic event in a certain point in time. And when we evaluate trauma among refugees, especially Afghans, we look at trauma from the trauma of country of origin, the country of escape during journey or immigration, and the trauma of the resettlement process. When it comes to the trauma of country of origin, the population of Afghanistan are highly exposed to traumatic events. Afghans have witnessed decades of collective trauma. I know Dr. Kuga will go in more details. Based on a study, a nationally representative study, which was conducted in 2019 and 2020, was published in early 2021 before the crisis in Afghanistan and government collapse. 60% of the people reported that they have experienced collective violence in relation to war. 48% reported 4 or more events. 64% personally experienced at least one traumatic event. 86% of the population had personally experienced or witnessed at least one trauma. So that is almost all of the population has witnessed some form of traumatic event. Trauma of migration process. As you know, Afghanistan is a landlocked country, and the evacuation should have taken place through the Kabul International Airport. That was the only way to get out. While the 80,000 Afghans were evacuated last year, there was still ongoing explosions, conflict, and a couple of hundred casualties, including civilians and the U.S. Army personnel. And the trauma of resettlement process. For some Afghans, only the geography of the problem changes, but they continue to have many issues even when they come here. They face multiple ongoing challenges such as low health literacy, limited English proficiency, barriers to effective patient-clinician communication, and structural factors such as housing, suitable employment, immigration challenges of bringing family members here to U.S. This slide is more detailed, but Dr. Kuga, I know he will go in much more details about how the resettlement process is causing more trauma and stress, so I won't go into details of this slide. And significance of trauma. So how many people we are talking about when we say Afghan trauma among or in Afghan refugee children? Out of the 80,000 people who were evacuated last year, half of them, 40,000, were children. And out of those 40,000, an estimated 1,500 were unaccompanied minors. By now, some of them have joined their family and relatives. Some might have still remained away from their parents. So 40,000 people. They were evacuated last year. By February 15, they were processed in U.S. military bases across the country, and now they are in our communities where we live in. And who are Afghans? Afghans, during 1970s, it was mentioned by Gulshan, and that we had a relatively small number of Afghans. The first wave of Afghans started coming to U.S. In 1980s when Soviet invaded Afghanistan. Afghanistan had the same situation like Ukraine does right now. For Afghanistan, we don't know how many years it will take for Ukraine, but for Afghanistan, it took 10 years for Soviets to withdraw. And during that period, many Afghans who were Fulbright scholars, diplomats, and business people, they stayed, but the number was not large in scale. The immigration of Afghans to U.S. continued through family unification and refugees to some extent from 1919 to 2014. And in 2014, when U.S. and international forces began withdrawing from Afghanistan, the insecurity escalated, and Afghans, the second wave, began coming to United States through SIVs, parolees, family unification, and last year it was peaked at 80,000 people were evacuated within 15 days. So by now, there are estimated some 250,000 in total Afghans or Afghan Americans or Afghans with or Americans with Afghan ancestry in the United States. The 2019 American Community Survey reported some 150,000 more or less individuals with Afghan ancestry, and that number Afghans continue to come in 2020, and in 2021 we had the 80,000 evacuation. By December, 80,000 people were evacuated from Afghanistan. Since December, January to November, the Afghans' arrival has continued, but not that much, not in large scale. We still have Afghans in United Arab Emirates, Qatar, and a few other countries who are still processed. But again, that might be in hundreds, and they are not in thousands. And we have some 250,000, more or less, Afghans in the United States by now. In fiscal year 2018, California received the most refugees from Afghanistan. 63.8% of the refugees to California were Afghans. And Sacramento received 52% of the statewide refugees. As Dr. Pollack mentioned, that it's affordable housing, and we already have a community here, so more and more Afghans prefer to live. I live here. I love it. It's diverse. So I'm sure more Afghans have the same reason to come here. As it was mentioned, 1 out of 9 Afghans, of all the Afghans in the U.S., live in Sacramento regions, or the greater Sacramento region, the Sacramento County, plus Yulo, Sutter, El Dorado, and Placer. Afghan refugees to the U.S. are from more educated and affluent segment of Afghan society compared to Afghans who are in Iran, Pakistan, Middle East, and even Europe. But Afghans compared to other refugees or other immigrants from other countries here in the U.S., they are comparatively in lower income category, and because they are refugees, not economic migrants. That's the difference. That's a whole another conversation. For refugees, they come even without a backpack. It's very hard to reestablish themselves. It takes decades for people to professional reentry, and that's why they remain in a lower economic category for a longer period compared to economic migrants. An estimated 6,000 Afghans, this is 2019 data, and by now we have a large influx, and this number might be doubled. 6,000 Afghans in Sacramento region lived in poverty, and their household income was about 28,000. The fertility rate for Afghans in Afghanistan, that is 5. So each family on average has 7 people, mom and dad plus 5 children, 7 people. But in the US, that is around 3. So let's say for 5 people, 28,000, the Afghans often remain under the poverty line. For Afghans, the poverty rate is in Sacramento is about 50%, while for the Sacramento natives, that is about 12%. So the takeaways that 250,000 Afghans in the U.S., 80,000 were evacuated last year, and half of them were children, and 1,500 were unaccompanied minors. And the trauma is, we're not looking at a single point in time. It's usually long-term and complex trauma, and Afghans are more refugees than immigrants, and they always struggle to reestablish themselves because of the challenges and the barriers that exist. And despite Afghanistan is a small country with some 40 million people, but it's a diverse country, around 3 to 4 ethnicities and 7 languages, and it's a diverse country. And whenever you have a program, an intervention, always consult with the family. Afghans are more family-oriented, and make sure that your intervention, your program is aligned with the culture and religious beliefs. So with that, I will end. Thank you very much. And if there is any question, please contact me at this email. Thank you very much.